Hey, what's up? Found this story out, so want to talk about it. So here we go. This is unreal, just unreal. CDC coronavirus tests were likely contaminated. Federal review confirms. Test kits for detecting the nation's earliest cases of the novel coronavirus failed because of likely contamination at the Center for Disease Control and Prevention, whose scientists did not thoroughly check the kits despite anomalies during manufacturing, according to a new federal review. The review, conducted by two Department of Health and Human Services lawyers, also said there was time pressure at the CDC to launch testing and lab practices that may have been insufficient to prevent the risk of contamination. The lawyers from the Department General Counsel's office were not named. I'm going to be honest. Um, this was not a mistake. This was done on purpose. They're just coming up with excuses. Neither the review released late Friday nor an accompanying statement from President Trump's chief spokesman at HHS assigned blame to any CDC scientist or official by name. The review is the first confirmation by the Trump administration that the original test kits were likely contaminated and that the problem appeared to have occurred in late January within the CDC's headquarters in Atlanta. In general, HHS has defended the administration's efforts to counter the pandemic. The three-page review also acknowledged that after weeks of delay, the likely contamination ultimately prompted the CDC to jettison a problematic component of the test kit. The component was intended to detect coronavirus strains other than the one that caused COVID-19, the disease that has killed more than 119,000 Americans. The Washington Post reported on April 18th that the test kits had generated false positive results caused by the CDC contamination. At 24 of the first 26 public health labs that tried them out before analyzing samples from actual patients. The Post also reported that an examination by the Food and Drug Administration had concluded that the tests failed because of substandard manufacturing practices and that the CDC violated its own laboratory protocol in making the kits. Why would you do that? The false positive arose during testing of negative control samples that contained highly purified water and no genetic material. The aspect of testing was essential to confirm that results would be reliable and not skewed by contamination. A spokesman for the CDC did not immediately respond to the request for a comment on the HHS review. The review was first reported Friday by Sinclair Broadcast Group. The CDC's failure with the test added many weeks of delays to the rollout of widespread testing and hampered efforts by state and local public health labs to minimize harm before the coronavirus became widely established in the United States. The review was based on the HHS lawyers' interviews with 9 CDC employees and contractors who were involved in the production of the test kits. The lawyers also spoke with Timothy Stenzel, a top FDA official regulating diagnostic service devices used for medical treatment, and one other FDA scientist in a consulting capacity, according to the review. The review identified several CDC labs involved with making the test kits. It said it was possible that contamination occurred during the production of materials for the kits performed by the Biotechnology Core Facility branch known as the Core Lab. But the review noted that the Core Lab took extreme precautionary measures to minimize any risk of contamination. The contamination most likely occurred in the CDC's respiratory virus diagnostic lab during its processing and testing of the materials produced by the Core Lab, the review said. It was at this stage of the manufacture when the bulk reagent materials for the test kits were processed and tested. The respiratory virus lab that were most likely exposed to positive control material, the review said. According to the review, the respiratory lab had already made multiple uses of the positive control material at the time bulk test kits regions were being handled, increasing the opportunities for contamination. The review also said that a number of CDC interviewees and Dr. Stencil of the FDA described lab practices that may have been insufficient to prevent the risk of contamination, though it is likely that time pressure also contributed. You don't care about the time pressure. I think that's just an excuse because you don't you will tell them, look, we're doing this right. We're taking our time. We're doing this right. We're not rushing anything. We're getting this right, and we're not going to add to the more to the death toll that already has been added. There were signs of trouble before the tests were sent to the public health labs, the review found. Before they were shipped out, the test kits began showing issues with negative controls, showing positive results, the review said. However, the kits were not vetted in advance with standard quality control and quality assurance, or QC/QA procedures, according to the review. It appears that time pressure to ship test kits out quickly and before QC had been conducted on them might have been compromised sufficient QC/QA to identify certain anomalies in data and realize the possibility of contamination before shipment, the review said. Asked by email if disciplinary action has been taken or is contemplated against any CDC employee involved with the test kits, an HHS spokeswoman declined to comment. President and former federal scientist experienced with infectious disease testing and a congressman who sought answers about what went wrong at the CDC said in interviews that sending out the kits without adequate quality control was indefensible. They should have waited, exactly, said Stephen A. Morse, a retired senior CDC microbiologist. Representative Raja Krishnamurti, a Democrat of Illinois, who has praised coronavirus testing efforts in South Korea, Taiwan, and other countries, said we have to look back at those weeks in February as having been the critical period in which the U.S. government's response totally failed. The top HHS spokesman, Assistant Secretary for Public Affairs, Michael Caputo, said in a statement that we had a backlog of tests in this country and subsequent responses to the post on Saturday. HHS titled the Trump administration's historic coronavirus response. A separate audit of the CDC's handling of the test kits remained underway by the HHS Office of Inspector General and is not expected to be completed until 2021. All right. There you have it, folks. I mean, these people didn't care to do this right. And I think they did this on purpose. I'll be very honest. They did this on purpose. I honestly think they did this on purpose. That's all I got to say when it comes to this. Let me know what you think in the comments. Because this is gross negligence in the highest form, in the highest degree. If their loved one caught coronavirus and died, how would they feel about this? And it's because they tried to get tested to see if they had the coronavirus and it ended up infecting them with coronavirus. I wonder how they would feel. I tell you now, it's a rabbit hole with this coronavirus, and it's not just, this was not an accident. This was done on purpose. I really think so. I really do believe, you're gonna call me conspiracy theory, but I really do think it's the depopulation and the stuff about Bill Gates and Dr. Fauci is real. We live in an evil world, folks. We live in a very evil world, and it's going to get worse. Stay prayed up to Jesus. No one else is going to help you. Stock up on food. It's going to get real. Especially, we don't know what's going to happen with this election. Not trying to scare you. We don't know what's going to happen with this election and after. All right. Later.